Earlier, I spoke with Dr. Ronald Cowan of the Addiction Center at Vanderbilt University in Nashville, Tennessee. I asked him what makes Molly such a popular drug.
Well, Molly has a reputation on the street as being a very pure form of MDMA. So people who are seeking MDMA buy Molly because they want the purest high and the best high they can get from it. So it's billed, if you look at the lingo around it, as a very pure form of MDMA that gives you sort of the perfect high. It seems now, however, that Molly is developing a reputation for quite some dangerous impurities as well, so that things marketed as pure MDMA often don't contain MDMA at all.
Can you tell us what it does to the body, what it does to the person taking it?
Sure. Well, when you take MDMA, it affects your brain very globally and the rest of your body. So it drives your blood pressure and your heart rate up because it has some stimulant properties, but it also shifts mood in an important way that makes people really enjoy the company of others, makes them care about each other, it makes them feel really, really close to each other. And in addition, it can produce some hallucinations or psychedelic symptoms. So young people who take it and go out dancing, for example, they get the stimulant that helps them dance, and and then they get sort of the effect of the strobe lights and other lights in the dance venue, and then there's kind of a hallucinatory quality to that. So those are the main reasons.
Long-term damage?
Well, so our studies looked at that because the animal studies had suggested that MDMA in laboratory animals caused permanent loss of serotonin function in the brain. So we designed a series of studies to actually determine whether we could see evidence for that in humans. And we found that now in two different cohorts. We found it in a study in a Boston cohort and also in a study in Nashville, that we found lower brain volume in people who had used ecstasy or MDMA. In addition, we wanted to look at brain function because serotonin is inhibitory in the brain, and so one marker of a loss or reduction in serotonin would be an increase in excitation in the brain, if you will. And our studies in multiple groups of users have also found the same thing, that there is this increased activation in the brain or increased excitability in the brain, which is quite consistent with a loss of serotonin. Then the third thing we did was we directly investigated the serotonin system by looking in the brain at markers of serotonin function called receptors. And we predicted that basically if you had lower serotonin in the brain, the receptors would be increased in number. And what we found was exactly as predicted if MDMA was a serotonin toxin, that the receptors were elevated in many areas of the brain in people who had used MDMA before. And I should say also in all these studies, we showed that the more MDMA a person had taken, the greater and the stronger the marker of the damage was.
Is there a flip side, though? I mean, when it comes to drugs, it seems like they may be bad if used in this way, but may be beneficial in another way. I mean, is there a flip side to this?
Well, I think many drugs, including those we use as therapeutic treatments, such as those for ADD or other things, have a dual side to them. There's been some evidence that MDMA, if taken in a psychotherapy setting where one takes a very low dose and then receives, psychotherapy treatment from trained professionals, may have beneficial effects, for example, in refractory post-traumatic stress disorder. That was a small study that had some confounds that needs replicating, but certainly the drug could hold the promise of being a therapeutic at a low dose, for example, but be potentially toxic at a higher dose, because one thing about MDMA, which the animal studies have shown us, is that the higher the dose, the greater the damage, and also if the body heats up, then the damage is also higher in the brain. So young people who take multiple doses of the drug, which they tend to do, they get their blood levels very high, and then they go dancing, which gets their body quite hot. So the combination of those two may really sort of maximize the damage that the contemporary, ecstasy user gets.
There's been references in popular culture, Madonna, Kanye West, a couple of the artists who have referred to Molly. Some states have seen 100% fold increase in the use of Molly. How alarmed should folks in this country and around the world be about this drug and what it's doing in terms of its tentacles getting out there into society?
Well, I think, so MDMA tends not to be so addicting as some other drugs, but the problem is that it's used often, on weekends when people go out to party, it's used pretty routinely. So the overall exposure to it can be pretty high. Our data would suggest that every time one takes a dose, if the dose is high enough, that you get some damage to your brain's serotonin system, right, which is somewhat permanent, or at least very, very long lasting. And that predisposes to things like anxiety and depression, for example, so we know rates of those metrics are higher. It also is associated with cognitive impairments, so memory and other impairments, sleep disturbances, alterations in pain perception. And the other concern is that the serotonin system, as we age, begins to decrease and change a bit. So we're also worried about the long-term consequences for these people as they age. There's another side, of course, is that MDMA alone, even when the pill is pure, is occasionally associated with severe side effects like death from seizure or from overheating the body or from too much water in the body. So those are also concerns from the MDMA, even in its pure form. In its adulterated form, for example, recent pills have been shown to contain bath salts such as methadone. It can be quite dangerous and fatal, as we've seen in some outbreaks where there's several fatalities associated with use of the drug.
Dr. Ronald Cowan, thank you so much for your time.